Welcome, everybody. Since I see it looks like we have a quorum, yay, I'll have welcome, meetings open, and we'll have roll call taken.
That sounds good. I'll be happy to do that, Dr. Jameson. A few housekeeping reminders. So we have Katie Charleston, who is hosting this webinar. As a reminder, please keep yourself muted if you're not the one presenting or making a comment. If you'd like to make a comment, please raise your electronic hand or indicate in the chat box that you would like to make a comment, and Katie will unmute you. And for those on the phone, please remember to mute yourselves, or else we will hear your private conversations. Madam Chair, there may be people on the telephone that would like to make a public comment, so we just want to remember to ask if there are any public comments on the phone. We also have our Carson City Conference location open to the public, so public comment may come from there as well. And now I'll take roll call. Dr. Jameson, I see you're present on Zoom. Ms. Valerie Clark.
Present.
Great. Ms. LaVon Lewis.
Present.
Dr. Sarah Friedman.
Present.
Mr. Jonathan Johnson. Mr. Jose Melendrez. I think we knew Jose was not going to make it today. Mr. Quincy Branch.
Present.
Suzanne Bierman. Commissioner Richardson. And Kelly Anderson.
Hi, Ryan. It's Suzanne. Sorry, I wasn't able to get off mute on time.
That's
Hi.
okay. It's great to see you. Thank you for joining.
Thank you.
And Kelly Anderson. Okay. Madam Chair, we have a quorum.
Dr. Jameson, you're on mute.
I know it wasn't responding, but all set now. So let's go ahead with public comment, and we'll start is there an office open in the north or south where public comment is occurring before we go to telephone, or is it all phone only?
We are open in the north here in Carson City.
And do we have anybody in the north here for public comment?
Chairwoman Jameson, this is Tiffany Davis for the record. I am here in our conference room in Carson City, and there is no one here for public comment.
Thank you, Tiffany. Then we'll go ahead. Anyone on the phone for public comment?
If you're on a phone line only, I went ahead and opened up the line so you can speak now. Or if you're on Zoom, you can add a comment in the chat and I will unmute you or raise your hand.
Give them a good minute or so. The line's been open, and it sounds like we're not hearing anyone for public comment. All right, we are going to move on to approving an action item, approving the minutes from February 24th board meeting. Do I have a board member who would like to make a motion to approve those?
So moved.
And second?
Second. Second the motion.
Was there any discussion about the minutes? Were there any omissions or edits? Hearing nothing, thank you for those very excellent minutes. And if there is any, will everybody who's in favor of the minutes, if you just say aye?
Aye.
Aye.
Anyone opposed to the minutes? So the minutes are passed unanimously, and we're going to move on to our very favorite part, which is our still new executive director's report. Ryan, thank you so much.
Sure thing. Thank you, Dr. Jameson. So this report closely mirrors the executive director section in the latest fiscal and operational report. The Silver State Health Insurance Exchange has spent the first half of 2022 wrapping up the exchange's third open enrollment period as a state-based exchange. The exchange concluded its third OEP at record-breaking levels, enrolling an astonishing 101,409 consumers, which is almost a 24% increase over the prior plan year of 81,900. The exchange continues operating on a hybrid staff schedule in both the Carson City and Henderson offices. Throughout this time period, the exchange continued to strengthen our working relationships with state agencies that include the Department of Employment, Training, and Rehabilitation, the Division of Welfare and Supportive Services, and the Division of Healthcare, Finance, and Policy, especially in relation to the anticipated ending of the COVID-19 Public Health Emergency, or PHE. The exchange has been coordinating on a monthly basis with DHCFP and DWSS to align on messaging and strategy to make sure no Nevadan is without coverage after redeterminations at the end of the PHE. Additional focuses for the exchange during this time period has been strategizing impacts of the potential expiration of increased APTC benefits found in the American Rescue Plan Act, or ARPA, the impact of potential premium increases for the upcoming plan year, carrier filing for the upcoming plan year, completion of the exchange's SMART audit, and prepping both our enrollment and eligibility systems and marketing and outreach strategy for the exchange's fourth upcoming open enrollment period for plan year 2023. Now, regarding vendor management, the exchange continued in the first half of this year its established quarterly technology enhancement cadence to NevadaHealthLink.com with its contracted enrollment and eligibility and call center vendor, Uninsured. During this reporting period, the GI technology platform performed its best to date during the last open enrollment, which concluded on January 15th, 2022, which was during this reporting period. It is important to note that during this past record-breaking enrollment year, the call center continued to maintain expected and contracted service levels for Nevada consumers, brokers, and navigators. The goal of meeting 85% of service levels has continued to be met. As a reminder, CSRs are reviewed against 27 scorecard categories to evaluate quality and accuracy of phone calls. As the exchange makes an effort every year to expand call center hours and availability into the weekends, the call center was open for both consumers and enrollment professionals, both Saturdays and Sundays throughout open enrollment. Additionally, the call center had extended hours until practically midnight on January 14th, 15th, and on the 20th to accommodate end of open enrollments. The Abby Agency, the exchange's marketing and outreach vendor of record, wrapped up its first open enrollment with an award-winning advertising campaign, garnering an award of excellence in community relations at the 2022 PRSA Silver Spikes Award for their advertising campaign for the exchange. The exchange continues to recognize the contributions that the Abby Agency's marketing and outreach strategies and campaigns made to the Nevada's plan year 2022 enrollment success. As a reminder, the exchange saw success in advertising storylines such as Traditions, Being There, Healing Knee, Super Saver, and Weightlifting. The successful core components of this advertising campaign will be carried forward into the next open enrollment in an effort to promote brand recognition. The Abby Agency and Katie Charlson, the exchange's communications manager, will highlight more on marketing and outreach in the following reports. Now, regarding continued preparation for the end of the PHE, throughout the first 6 months of 2022, the exchange has been coordinating with the Department of Welfare and Supportive Services and the Division of Healthcare, Financing, and Policy to adequately plan how to best service Nevadans needing health insurance coverage in the event that they transition off of Medicaid when redeterminations begin in volume at the end of the PHE. As the end of the PHE is still yet to be determined at the writing of this report, the exchange is actively planning the two aforementioned state agencies and its vendor Uninsured in order to assure that Nevadans in need will properly and efficiently be account transferred when appropriate to the exchange for a seamless opportunity for coverage. Those Medicaid clients who will be redetermined to not be eligible for Medicaid coverage will be electronically sent to the exchange, where their information will pre-populate an exchange qualified health plan application, and the consumer will be sent a unique code to come claim their application and account. The consumer can shop plans that best fits their needs. While this process is the same automated process the exchange has had for the past 3 years since becoming a state-based exchange, staff will also be performing manual quality control checks to ensure the account transfer process is working properly, especially in light of the anticipated increased volume. The exchange is still planning and budgeting to enhance its contracted call center through funding from the Center for Medicare and Medicaid Services State Exchange Modernization Grant. These are federal funds that we received from CMS. Upon final direction from the Center for Medicare and Medicaid Services that the PHE will definitively end, the exchange will stand up through Get Insured, a special team of CSRs charged with making outreach to redetermined Medicaid clients that are deemed ineligible to continue on Medicaid and who are transferred to the exchange. This special team of CSRs will educate those consumers as to exchange coverage options, including but not limited to specific Medicaid transition plans on the marketplace from carriers that are also a Nevada Medicaid managed care organization. These transition plans are designed to help make transitioning as easy as possible if consumers on those specified MCOs wish to continue with their same providers. Now, regarding federal and state legislation updates. From January 2022 to June 2022, the exchange tracked a number of federal and state legislative priorities that continue to have direct impacts on the exchange. These priorities include the American Rescue Plan Act, or ARPA, Build Back Better Act, CMS's Plan Year 2023 Notice of Benefit and Payment Parameters, Senate Bill 420, and Nevada Assembly Bill 432. As mentioned before, in previous board reports, executive director reports, ARPA provided over 17,000 Nevadans to enroll with increased subsidies, expanded FPL thresholds, federal poverty level thresholds, and automatic $0 plans for consumers who acquired unemployment insurance during calendar year 2021. Many of these enhancements are critical benefits suggested to be extended in various versions of the President's Social Services and Healthcare Build Back Better Act. Another topic that the exchange paid particular attention to recently is on April 5th, 2022, the Internal Revenue Service issued a final rule to fix a longstanding conundrum for employer-sponsored healthcare known as the family glitch. Oh, sure. Hold on 1 second. We're going to switch to the phone real quick.
I was hearing loud and clear. Was someone having trouble hearing?
I actually was.
Oh.
It was going in and out quite a bit.
My message was very strong, and is anybody else having difficulty?
I was just at the end. It got really quiet. I couldn't hear anything.
Oh, okay. Ryan, why don't you then try again?
Can you hear me now? Let's see, can you hear me?
Yes.
Really loud and clear. I'm now going to turn my sound
There
down.
we go.
Much better. Thank you.
Okay, great. Thanks, Katie, for helping out. So I was just about to talk about the IRS family glitch interpretation. So on April 5th, 2022, the Internal Revenue Service issued a rule to fix a long-standing conundrum of employer-sponsored healthcare known as the family glitch. So as it is currently interpreted, the family glitch, as stated by the White House, is under the ACA, people who do not have access to affordable health insurance to their jobs may qualify for a premium tax credit to purchase affordable, high-quality coverage on the ACA's health insurance marketplaces. Current regulations define employer-based health insurance as affordable if the coverage solely for the employee, and not for family members is affordable, which makes family members ineligible for a premium tax credit even though they needed to afford high-quality coverage to the marketplace. So the fix to the family glitch is now to calculate affordability based on the entire family, not solely on the employee, and to extend marketplace subsidies to millions of family members, primarily children and women, who are currently ineligible for financial help through the marketplaces because affordability is calculated solely on the employee. So we are watching that closely, and I believe there's supposed to be an interpretation out by, or a final rule out by the end of this month, at the end of June. State level legislation. Continuing on the state level, two important pieces of legislation that the exchange continues to follow closely and that may have significant impact in the future is AB 432, which will designate the exchange as an automatic voter registration agency, and SB 420, commonly referred to as a public option bill. The exchange has had conversations in June with the Center for Secure and Modern Elections, an organization that aligns bipartisan and pro-voter campaigns regarding operationalizing the exchange's automatic voter registration mandate in AB 432. Next steps include conversations with the Nevada Secretary of State's office regarding how to transfer required data elements in our application to them when exchange consumers indicate they wish to register to vote. The exchange has also advanced the conversation and technical planning in relation to SB 420, the public option bill. The exchange is in initial conversations with Get Insured to initially architect how the marketplace platform will accept and display carrier public option design plans. While the public option bill is not expected to be up and running until January 1 of 2026, the exchange is initiating the planning process now. Now, regarding our audits, our plan year 2021 programmatic and fiscal audits. The exchange completed its programmatic and financial audits in May of 2022. The programmatic audit was conducted through the auditing firm Barry Dunn, and the financial audit through the State of Nevada Division of Internal Audits. For the programmatic audit, Barry Dunn examined the compliance of the exchange with the requirements in subparts of the Code of Federal Regulations that are listed here, C, D, E, F, K, and M. And this was during, which ended during June 30th of 2021. So it went from July 1st of 2020 to June 30th of 2021. So the audit process included verbal interviews with exchange staff, written interviews of exchange enrollment partners, and staff from the Division of Insurance, review of exchange documents and policies and procedures, as well as sampling of enrollees to ensure appropriate eligibility and enrollment. The exchange did receive two minor findings. The findings were a defect in the second lowest cost silver plan calculation logic, which caused the SLCSP to be calculated with the wrong number of applicable children for SLCSP. This system coding error was corrected in September of 2021, so it's already been corrected. Again, this audit is a look back to a previous year. And two, a system coding error that calculated incorrect age factors, which resulted in incorrect APTC amounts for some consumers, not all, just some, during a batch redetermination process that was implemented in June 2021. This error was detected and corrected in September of 2021. Again, this has already been corrected. For the financial audit, the Division of Internal Audits performed a fiscal review covering the period July 1, 2020 through June 30th of 2021. The purpose of the review was to assess the exchange's internal controls for compliance against established authority. The review process included verbal interviews with the exchange fiscal staff and thorough review of internal controls over management control environment, revenues and accounts receivable, purchasing and expenditures, travel, contracts, and procurement cards to ensure compliance with state and federal laws, regulations, and guidelines. Based on review findings, the Division of Internal Audits recommended that some internal controls could be improved and that some policy and procedures could be updated. Exchange staff is currently working on addressing the recommendations of the Division of Internal Audits and updating the agency's policies and procedures. And now my favorite part of this report here, new exchange staff for 2022. The exchange is growing and maturing. The exchange is excited to announce that Janelle Davis, the exchange's former communications manager, applied for and has been selected to the exchange's Chief Operations Officer position. Janelle has been with the exchange since 2015 and brings almost 7 years of experience and institutional knowledge to the COO position. Please join me in welcoming Janelle to her new role and responsibilities with the exchange. So with Janelle advancing internally, that left the communications manager position open within the exchange. I'm pleased to announce that another internal candidate applied and was selected to advance their career with the exchange. Katie Charleston, the exchange's former training specialist and marketing assistant, has been selected to be the exchange's new communications manager. In her former role, Katie was not only supported the exchange's information technology manager in day-to-day IT duties, but also supported Janelle in her communications manager role. Katie is coming into her new duties with an understanding of marketing and outreach and an already established relationship with the Abbey agency. The third position that the exchange has promoted is Brooke Mills, from Appeals Coordinator to Data Analyst. The Data Analyst position is based under the Chief Operations Officer team and will assist the exchange with in-depth data analysis in regards to enrollments, CMS requests, recon support, policy needs, and marketing and outreach support. Please join me in welcoming Brooke to her new role. And then finally, with Brooke moving into the Data Analyst role, a vacancy was left in the Appeals Coordinator position. This position works closely with the Quality Assurance team in attempting to resolve appeals and complaints before they advance to a hearing. Although the talent pool of applications for this position was competitive, please join me in welcoming Bree Wright, former program officer with the QA team, to her new position as Appeals Coordinator for the exchange. Bree's experience with the QA team will provide an added benefit and efficiency in administering the exchange's appeals process. And that's my report, Dr. Jameson.
Excellent. Let me see here. You can hear me, right?
I can, yes.
Okay, great. Well, first, thank you for that wonderful report, Ryan. And thank you for telling us about our new, well, shall I say, our old staff that have all been able to move into their new positions. This is so exciting. And I'm happy for each and every one of them. So congratulations, Janelle Davis and Katie Charleston and Brooke Mills and Bree Wright. This is just absolutely wonderful. Congratulations, and thank you so much for staying with us. And it's really a sign that you've been very happy and that the exchange is not only effective, but an excellent team and has good camaraderie. It speaks so well of all of you that you like it working there and you are a good team together, that all of these people wanted to apply and move within the organization, stay within the organization, and continue to work together. So I congratulate all of you, and I really, again, congratulate you for all this great work that Ryan has just reviewed that you've been all involved with. For myself, I have a couple questions, but before I ask them, I'd like to put it all over to my board. They may beat me to the questions. How about my board members? Do you have any comments or questions on that report from Ryan? Well, not hearing anything, I actually don't have too many, but on the interest, because part of the material we covered was some of the material we covered last time, and not much change there as we wait to hear some of the final dispositions from the about the IRS on the family glitch, and then also some of the other issues that you covered. The only really kind of new thing that I wanted to ask a couple more questions about was I'm very happy about your internal audit and looking to see how things went and if there were any concerns, and doing that so that you can figure out how we might improve things. So congratulations, because that's what it's all about, trying to always make it a better place. So what I was wondering, when you discovered that there were a number of people that there was a defect in the second lowest plan, the silver plan, which when calculated caused the second lowest silver plan to be calculated with the wrong number of applicable children for that plan. What I just kind of wondered was how many of our customers were affected by that, and was it in favor of the customer, or was it not in favor of the customer, so that children may have been left off, or if you understand my question.
I do, and I believe it's an extremely limited number, almost one-offs, I would say. So the way the methodology that went is we provide Barry Dunn with a list of all the applicants for that plan, that given year. And let's say it was 140,000 applicants. You know, our enrollees are less than the applicants, but this is the number, their universe to begin with is the number of applicants. So let's say that's 140,000. Out of that 140,000, then they take a random sample size of about 130 consumers. So then we, and I have to give kudos to the policy team, to Gina and Justin. They were just fantastic about this, and they were almost surgical in the way that they went through and explained to Barry Dunn about why some consumers got APTC, why some didn't, about the exceptions, about the interplay with Medicaid rules as well. So what happens, we got down to, I want to say, of the 130, we justified everybody, but I want to say maybe just 3 or 4 of those sample sizes. And these 2 findings came off of 1 or 2, of those 3 or 4, these 2 findings here came out of that a very small pot there. So to answer your question, I believe really this was just a system error or glitch in a limited individual basis, not a system-wide issue there. And I don't know, I'll have to get back to you to see which way the error went, if it was against or for the consumer. I don't have that off the top of my head, but I can certainly get back to you about that.
Only then the following question would be, was it adjusted if it was against the consumer, or and then just to follow up on that was, of course, the second area where you had a system coding error for calculating incorrect age factors. How large was that?
Again, I want to say this was a one-off on that.
Okay.
3 or 4 out of the sample size of 130 that we couldn't get to a resolution on. I want to say 1 was for the first error and 1 consumer case was for the second error. I don't know if it was a larger, but I can certainly follow up with the board, with you and the board, to let you know what the scope of that was.
And the only concern our board would have is that the customers, if they were at if there was any disadvantage to them, if it's been adjusted, and then of course going forward, you are planning to see what you can do to correct that from the future. And I think that as variances and best laid plans go, that this is pretty small group affected from what you're saying with me, more one-offs than actually any large segments. So I think that anytime we do things in this scale, we're going to have a couple things fall through the cracks. So I think overall, I would say practically perfect in every way.
We were happy with the findings.
Yes.
We never want to have any, but these extremely small findings.
And that was what I wanted to know. So very good, very good. And while we've been chatting, did our board have any other questions? Because actually everything else is very straightforward. And I had no further questions on your very, very good report, Ryan.
Thank you.
So moving on from the report then, and we really do appreciate the written report and look forward to continued written reports in case you ever had a question. Once sure. Heather brought up, do you think I should really do this written report? Absolutely. And moving on to marketing and outreach update.
Hi. I think that's going to be me. My name is Ashley Bear. I am Director of Client Strategy at the Abby Agency. Just want to check that you can hear me okay. So I'm working. Clear. Okay, perfect. All right. So we have a presentation that we'd like to share with you. Some of it Ryan did touch on a little bit, but we'll give you a little bit more in depth on how we've been working with the exchange and our partners throughout the off season, from post open enrollment through to now. Let me just move this. Okay. So in that period from the last time we met in February through to now and then ongoing into September, the Abby Agency has been working with the exchange And like I said, our partners at Marketing for Change and Erica Avila's Consulting to really do a deep dive into the Nevada HealthLink audience and do some reporting and data analysis on our potential consumers, and understanding the success of open enrollment and how we can prepare and optimize for the next upcoming open enrollment and plan year. This has come in the form of multiple research projects. So I'm going to go through each of those and touch a little bit on about the research project and then some of the key findings for each, and then how we're incorporating that here moving forward. So the first research project that we worked on was our target market survey. This was looking at potential Nevada HealthLink customers, specifically the uninsured, self-insured, and then current Medicaid recipients, noting that we knew the unwinding of the public health emergency was going to potentially happen this year, and we wanted to start doing some background research so we better understood that audience. So understanding the profiles of these customers, assessing the awareness levels of Nevada HealthLink with each, and then identifying motivators and obstacles for purchasing health insurance, and a little bit of evaluating the open enrollment advertising campaign as well. So some of the key findings that came out of this: the uninsured audience, in particular in Nevada, are mostly formally insured. So, for example, they had insurance through their employer, but then lost their job. So that's good for us to note. Health insurance for some of these audiences can seem out of reach. We do know that the key issue is money or cost. 1 out of 3 uninsured Nevadans want to be insured, but they are just waiting until they are financially stable enough to do so. And then we found that there is a need in the uninsured market. 4 out of 10 uninsured Nevadans do want health insurance this year, so that's great. So we'll be looking at actively reaching them during our open enrollment period this next year. If you look off to the right, we have some visual aids. The first at the top, again, understanding those motivators and obstacles. So why didn't you buy health insurance plan after visiting Nevada HealthLink? Again, we know that cost is the #1 reason why, so they didn't find an affordable plan. Or couldn't find the right plan. But then we also found that to note, the application process wasn't completed because it was difficult or confusing. And then the website also a little bit confusing, and we'll touch kind of on how we're looking at those, because those are some actionable components for us. The second visual, have you heard anything about Nevada HealthLink? So that's us understanding which of these audiences best already knows Nevada HealthLink or has the highest awareness levels, and which of these don't. This makes a lot of sense to us. We saw the self-insured audience last year with some of our marketing on LinkedIn through open enrollment being highly engaged and interested. So that's great. We developed a small business toolkit in the off season to help reach this market, and are further identifying in open enrollment this next season how we can better reach the self-insured. Makes a lot of sense that the Medicaid audience has the lowest awareness rate. They have health insurance through Medicaid currently. There isn't currently a need for them to look for additional options for health insurance. So good for us to know. And then also important for us to see where the uninsured market fits and how much do we need to drive awareness or engage in even more like down the funnel tactics of pushing them into enrollment, see where we sit there. And then the last visual, this is for us to gauge our open enrollment advertising plan from last year and then incorporate this into next year's paid media plan. Which of these tactics best hit? Google search always does really well, but we were surprised to see that our social media advertising efforts were very, very strong. And then there's just little subtleties like knowing that audio streaming outperforms broadcast radio. Of course, we're going to continue to do both, but good for us when we're thinking about where the allocation of spend falls and how we're reaching our audience. The second research project that we put together was
Normally, I don't interrupt your presentation, but there's so much information to unpack here for the board. And I want to applaud you on your study, survey, etc. Some of those findings, can you go back to the page
Sure.
1, are a little surprising to me.
Okay.
So I would like to ask you what the audience size was.
Oh, that's a good question. Katie, I'm wondering if, I know that Peter and Aaron from Marketing for Change are in the audience. Are you able to promote them to panelists or allow them to speak? Because they are our partners at Marketing for Change are much more intimate with the sample size and the development of the surveys.
Absolutely. Aaron and Peter, I have you on right now.
Thank you.
Okay, can you hear me?
Yes.
I do want to thank you once again for doing this excellent survey, because this is just telling us so much about how effective we are and can be. It's sort of like the audit Ryan just finished. The better we can analyze what's going on, the better we can serve. And this is just fantastic. So yeah, I wanted to know the audience size and definitely the date of the survey. I'm certainly imagining it preceded the economy problems that we're having right now, because I wouldn't be surprised if this was even, if it was prior to the last few months, that if you repeated it today, we'd even have more on the can't find affordable plan part. And so the sample size, the date, and then what I'm really looking at for 50% of people couldn't find affordable health plan. We have this amazing service we offered that immediately directs them to a broker. And I thought that was going to solve this, couldn't complete an application and couldn't find affordable plan. So if you can address some of those questions, I would really appreciate it. And then just saying this so I don't forget, and then the other board members can chime in and I'll back off. I think it'll be really important for us to repeat this each year and see what kind of improvements we make. Go ahead.
So first of all, I love your questions. We did this between January 26th, 2022 and February 24th. Most of the sample was in the beginning of that. So in the January 26th, kind of the first week of that. The total N was 800. I'm trying to remember all the questions. And we are going to repeat this. In fact, we're thinking about we've did a number of surveys. You'll hear about some of the other surveys. We're thinking about taking that same budget and investing it into a more robust survey that will give us more information focused on the target market. What question? I don't know if I answered all your questions.
Thank you, because, and that's what I wanted to say, because some of these responses, like the 50% in couldn't find affordable plan, that needs a real drill down. I know Ryan wants to know about that, right, Ryan? And the others, though, website confusion minimal. People are getting savvy. Our website's pretty perfect, practically. But couldn't find the right plan. 30% say they couldn't find the right plan. These need drill downs. Couldn't find affordable plan. Go ahead.
So I think that this is the kind of thing that these are all, some of these are addressable by marketing. Some of them, the actual price of the plan, of course, is not something that's in our purview. But as far as the shopping experience, we're looking at that, and we're actually doing UX research, user research right now that is specific to the website. So it's not just whether they're confused by the website, but it's whether they can find the best plan. So are we giving them the best experience so they can find a plan that fits them, or is it they're just not a plan like that exists? And so we are finding some areas where we can improve in that area. So we try to look at the full journey from, are we getting their attention, which I think we did a really good job of this last time, to are they going through enrollment, and look at each piece of that and what's happening. And so this survey is part of looks at sort of the top of the funnel a lot. There's a user survey that we do. There's some other things you'll come across that look at different points in the journey. But this is really about, and these the numbers, like can't find an affordable plan. I know that's our highest, but that's always likely to be the highest if we were to look at exchanges everywhere around the country. That's just an issue with the pricing of insurance and what people expect it to be and what it actually ends up being. I should mention that we do this for other states, so that's how we.
You're on mute, Dr. Jameson.
Oh, Valerie, if you're there, could you make a comment on if, since we implemented the availability of finding that broker so easily on our website, do you feel that you've noticed a difference?
Hi, Dr. Jameson, Valerie Clark for the record. I have not heard of anyone having trouble. I don't sell on the exchange. I do refer it to, I have a person that I refer all of our exchange business to, and she's very busy. I've never heard of anyone having trouble finding a broker on the exchange. But I will tell you that in regards to the availability, you know, where people say they didn't find the right plan or affordable plan, the one bit of feedback that I do get very frequently is people coming off of group plans that go to the exchange. It is different. It's a very different, the plan designs are very different. And so you might see a lot of people coming off of group programs saying, well, I didn't find the right plan because it didn't match an expectation that they had from being on a group plan prior. So that's my guess as to why you're having that issue.
Yeah, excellent comment. Yes, because if they came off group or employee plans and had a very minimal, it's an entirely different thing when you're looking for a quality health plan that's single person or group plan. So,
Yeah.
I mean, a family plan. So any other comments on this? And we'll let her go on with her report because I know she has a lot to go through. Ryan, did you have a comment before we go through? All right.
Good.
Okay.
Perfect. So we'll move to the next one, and I'll pause if you have questions after each. I have 4 research projects, so there is quite a bit. As Peter mentioned, the next research project was the biannual pulse check survey. So we do this twice a year. This is the audience is the general population of Nevada. We do this is a larger pulse kind of check of both the brand, and then we did as well the open enrollment campaign to understand the views on Nevada HealthLink. Has it changed in the last 6 months? If so, how? So the key findings are that both awareness and favorability of the Nevada HealthLink brand among the general public is stable, which is fantastic. Awareness of open enrollment. So we look at year over year. So last open enrollment versus this most recent open enrollment campaign did grow both in the self-insured and uninsured Nevadan audience. So that's great. And both brand favorability and campaign awareness were higher among families with children. This, to us, made a lot of sense. Quite a bit of our marketing did focus on showcasing the family unit, making sure to speak about caring and protecting for your family. So it wasn't surprising to us, and we were very pleased to see that this was resonating with families with children. And then there was a correlation between exposure to advertising messaging and higher favorability rankings overall. So that's fantastic. So the more the consumer was seeing advertising of the open enrollment campaign, the higher the favorability of the Nevada HealthLink brand. So not only was the open enrollment campaign successful in speaking about open enrollment, driving awareness and enrollment, but it also helps support the Nevada and builds the Nevada HealthLink brand, which is fantastic. The third research project that we conducted was the user survey. So this is the one that Peter was just speaking about, where we took those consumers that had mentioned that in the first survey that they were having trouble with the website or the shopping process, and we wanted to dive deeper into understanding what are the reasons why you had difficulty with that, because that is where we have the most ability to affect change. And we even went a little bit further and broke it down into 4 components: invitation, which is the email communication series and driving them to enroll; the website user experience; and then shifting from website into the shopping and purchase. So the components of Get Insured as well, to see where along the process were consumers having trouble and what were they having trouble with. It is important to note that in the overall survey, most of the people that were surveyed in general did find that the website was easy to navigate. 8 out of 10 were likely to recommend. We were just taking that kind of 2 out of 10 and really breaking it down and going, okay, what were the reasons why you had issues, just so that we understood. Some key items that popped out: website organization in general was confusing to the consumer, and technical language was not intuitive for some. So we're actually conducting an audit right now and building out kind of an action item punch list, if you will, of how to best organize the website based on some of their feedback. And we are going to send that to review with the exchange and work on that prior to open enrollment this next year. And as well, reviewing the copywriting on the website and understanding the technical language. We know that there is a necessity for having some of this technical language, but I think that there's an opportunity to look at it in when the consumer goes to the website first, speaking to them in a more conversational manner where it's a little bit easier to understand. And then as they read further, or if they have more information that they need to find, then having that technical language kind of come in, because there is a need for both, I believe. In the shopping experience, we wanted to dive deeper into that to make sure that we could provide Get Insured in the exchange with some actionable items there. The main pieces that came through from the consumer, it was not easy to make comparisons. And there were unclear directions, and it's not as easy as other shopping experiences. And I truly believe this is a case of the consumer being very well trained in some really fantastic shopping experiences across the board. I don't think you can't, from an app or the website, any website, you can buy all your groceries, you can compare all of your flights. Like, the consumer has been very well trained in order to how to shop online. And there are some really well put together, clear and concise shopping tools for consumers in general. And this shopping tool is just a little bit more in depth and a little bit more difficult. So the exchange is working with Get Insured to take our findings from this research survey, as Ryan mentioned, and see what can be implemented to help simplify and make the experience a little bit more clear for the consumer. And our last research project, which we actually just completed and shared out.
I wanted to ask Ryan if he had any comments on that, or our board members had any comments on that.
I don't have any comments directly on this, but when we transitioned off of healthcare.gov to become a state-based exchange, I know one of our biggest points was we wanted to do a lot more with the data on our consumers, to do a deep dive to see who they are, what their concerns are, where they are, and how we can improve the user experience for them. And these research projects here, I feel like are only the tip of the iceberg into really customizing our product and our service for consumers in Nevada. And each time we review these new data sets and these new findings and these new surveys, I feel like it's only improving our website in Nevada HealthLink.
And my only comment was when, things such as we've come a really long way. Number one, our current platform, our current website is incredibly sophisticated and has come a long way. And when they say 47% extremely likely, only 72%, and then 72% likely, of course, we'd love to get those numbers up to 98%. But it's inherent in the nature of our product when they say not as easy as other shopping experiences. Well, most other shopping experiences, comparing trips, vacations, comparing houses, and even comparing, so many other things, they are pretty straightforward. And I actually want to applaud everyone on taking the most complicated shopping experience and even making it as presentable as it is, because some of our early experiences were quite deficient. And it is the nature of the beast we're wrestling with. But of course, that doesn't mean we're going to be happy with where we're at, especially when we see these numbers. And with more technology and technology advances, hopefully we can get better and better. But of course, it's not going to be as easy as other shopping experiences. This is an incredibly complicated beast to wrestle with on the shopping experience. And I just want to say, having said that, we're going to try to do much better. We want to get in the 90%. But where we've come and how challenging this is. And so I'm looking forward to hearing how people can make it better. But I just, on a positive note, wanted to say this doesn't, it says what's the problem, but we really still, we haven't gotten down to the real, microscopic look at this to see what we can maybe really do. And I'm not sure who's going to be doing that. I imagine a lot of it's done, not just with the website, but the platform, Get Insured, are probably working on some more things.
And Dr. Jameson, I did want to add that point too, is that the Abbott Agency and Marketing for Change, we did have conversations with developers over at Get Insured. So we are coordinating, we're sharing these findings with them. They're being receptive. So there is that. I just wanted to assure you and the rest of the board that there is that collaboration there and the sharing of information to just continually improve the product and the user experience.
The Get Insured people are nothing short of brilliant, but we never want to get complacent. But when it says not as easy as other shopping experiences, I don't think you're talking apples and apples. And so I can't imagine that there is another exchange experience in our country. If you're saying not as easy as other exchange shopping experiences, I can't imagine that any one of them is better than ours. So not as easy as other shopping experiences in other areas. Because if there's an exchange that has a better shopping experience than ours, I want to know about it. And so does our board.
Definitely. Okay. Good to move to the next project. All right. So the last research project that we put together was on the Latino audience. We've always found this, of course, this is a key demographic for us when in the state of Nevada in general, but we've always looked to describe the Hispanic audience in kind of one way, with utilizing thinking of them as one audience. And we really felt it was time to do a deeper dive and break down this audience to better understand all of the cohorts within. What does the younger Hispanic audience prefer versus the older Hispanic audience, those that are single versus those that are in families. Let's really kind of drill down in that so that we can better prepare messaging and advertisement and owned content for this audience. The key findings from this, there's quite a few, but all really valuable. First, that family drives much of the health insurance discussion. I think we knew that last year, but what we found that was interesting this time around is that a portion of that is that others are more important than self. So it's not just a strong value in the family unit, but it's also important that parents are thinking of their children more so than their own personal self and ensuring themselves. It was also interesting to note that when it came to finances, that personal financial ruin was not a top driver for this audience. There were a number of those that we spoke to that were first generation immigrants that came to this country without anything in their pocket, and they've dealt with financial components like this before, so they're not as concerned as other target audiences that we have spoken to. Additionally, younger audiences focus on getting ahead now in the near future. There was a portion of the audiences that we spoke to that were very proud to note that they had investment properties. They're really thinking ahead starting now. So that was really great to note. Middle-aged adults spoke of both caring for their parents, thinking about retirement, and then watching their adult children grow. So again, breaking down that idea of family and how that works together for this target audience. We also spoke to some self-employed individuals, trying to better understand that self-employed audience and then the Hispanic self-employed audience. We saw a strong response from them in the last open enrollment period. These respondents did note that they will deprive themselves of insurance as it was seen as cost prohibitive, and that they find that it's better for them to have money in their pocket now to make payroll or pay business expenses for this month rather than saving for future potential issues that might happen with their health care. The uninsured respondents, this wasn't a shock to us, but the uninsured respondents within this cohort felt that healthcare was out of reach, especially for the Latino audience. We know that cost is always, as we discussed already, it's always something that is brought up with health insurance. And as Peter mentioned earlier, this isn't new for Nevada. This is something that we see as a trend across different states. But some really positive things that came out of this survey, respondents showed a lot of appreciation for attempts from Nevada HealthLink to reach the Latino community. They were very happy to know that there was marketing and advertising that was directed towards them, that was authentic to them, and that research was being done to better understand that audience. All of that was really positively perceived. So really happy to know that our most recent efforts have been positively impacting this audience, and we're excited to take some of these findings and work this into the next open enrollment and future advertising so that we're better reaching this audience.
My question, of course, all of these people that you made part of your group and audience for the Latinos, then these were they were not the illegal immigrants. They were people that would actually be available, would be able to come on to our plan.
I will let Peter speak to that. I think there were a few, but
yeah, there were a few. Yeah, we didn't check their IDs in that case but we recruited for people that would be potentially able to buy. So there were a few people that are may not actually be, there's a maybe some not a full understanding of where they are citizen wise by themselves. So they got in the group, but almost all of these were people, yes, that could qualify. And what you have to remember about this, these are groups we just did. So there were there was a good increase of Latino in that gain that Ryan talked about. A lot of those were Latino. Those people were not going to be in these groups because we were looking specifically at uninsured. So this is essentially like, we kind of keep raising the bar on ourselves. So we're not looking at sort of our past success. We're looking at where are we going to get a future success. And so these are going to be a tougher audience than the one we got last year. And, each year, hopefully, as we grow this, the audiences get tougher and tougher, but we try to raise our game so we can reach them. So that's part of what we're trying to do this is to learn more. There's also not been, surprisingly, the amount of Latino research specifically in Nevada is not what we see in some other states. It's mostly the political stuff. So it's just interesting. This is kind of interesting more widely too.
I just want to, yes, very good. I just want to clarify that it's very important for this to be an accurate research, number 4, that it just has to be people that are legal citizens. And what I'm really curious about, a question I would like to know is what is these people that are attending, what income bracket do they fall in, these people that are attending? What do they actually feel they have as discretionary funds that they can put towards a health plan? Do they think it's $40 a month? Do they think it's?
They think it's very, they're very lower income.
Right.
And
then Ryan, sorry, I interrupted you. Please go on.
So they're lower income, but we tried to target people that were sort of above Medicaid. So they're, more like what our customers would be. But they were generally lower income, generally thought, they don't have a lot of extra money sitting around. And so, yes, the money was a huge issue for them. And, but they were, and remember, this is not because of how we recruited it. It's not representative. We were purposely going after these people. So, but among these people, they were not very aware of what they could get off the, from Nevada Health Link. Because the people that were more aware, of course, are people that we were able to recruit earlier.
So Ryan, how would you tell them what plan we have available for them?
My first inclination would be to connect them with a licensed broker and or navigator and have the experts walk these consumers through, step by step, and give them, the type of advice that they're trained to give to make the shopping experience optimal for these consumers.
That's a good plan. That's a good response, Ryan. Safe. Now, Heather used to talk about our kind of $0 in plan for people that got the limited plan, but I don't remember what the words were that she referred to it as. Kind of the default plan. It wasn't really, platinum, gold, sort of an.
The bronze.
Wasn't the bronze where they were.
Oh, there's also for those under, I believe, age 29 catastrophic plans.
Maybe that was it. Perhaps that's, but she didn't use that word. But perhaps that's it. And those are still important plans in a group like this, because I will tell you the thing I hear about from the Latin Americans are that even if they are legally here, is that we have the worst healthcare in the world, and that they can't in this system, in the sense that they can't afford the system, and if they get it, if they worked here for 20 years legally, then they lose their house. And that there's no real options, and there's got to be an option for those people here. And so even if it's a catastrophic plan and they understand that, and they get to a broker and they get into the hospital and they're losing, they have debts of $100,000, $200,000, they don't lose their house they work so hard for, and hopefully our brokers are sending that message home to them. And so and do you guys, when you're done doing your research, do you try to tell them that there could be an avenue and recommend them to a broker anyway?
We didn't, that would be a good idea. We didn't actually reference with this group the brokers, but we did note, and this is very common, it happens in focus groups. As the discussion continued, part of this is they saw the ads, so many of them hadn't seen the ads because of the way we recruited. And there was the level of interest in following up. So the number of people were going to go to the website, see what was there. They were much more interested than they were in the beginning, which is not uncommon with focus groups, because you're talking about all the benefits and so on. And after a conversation like that, they're much more interested.
And I want to applaud you for the research, for the past programs where you, when all of this came about, and Obama would talk about the Affordable Health Plan, the big driving force was all the medical bankruptcy. It was like #1 cause of bankruptcy in the country. And you, in the past, the advertising has focused too, you know, when you have something, don't let this be making you financially medically bankrupt. I haven't seen as many of those. I might have missed them myself, but I still think that's an important drawing card for this population, particularly if they could just get that message and understand it.
Yeah, I think logically that's true, but what we found in the experience with that message is individually it's not. There's an optimism bias that we all have, like not just this group.
Yeah.
And there's and so it tends to be people go by their experience, and you know, and this has gone back since the beginning of what we did the research when this first set up by CMS for healthcare.gov, and we would hear it then, and we've been hearing it all the way through for years and years and years of people just explaining to you about, hey, here's how I work out the money. So they have to see a more present day reward, like a reward, an immediate reward. And so to them, it's the peace of mind, it's being able to feel like they're making it. That kind of thing is actually more motivating, where logically, if you break it down logically, you're like, no, it's about not going bankrupt. But that logic is, and you know, this is like a lot of advertising. You have to go to where they are. You can't really start with, hey, come on, listen to us. You're dangerous.
Thank you. Any other board comments? Okay, we'll move on.
Perfect. Yeah, I did want to note two things just to build on that. One, we did find it valuable to include or to not check status when conducting this project, because it is important that even if the person participating in the project may not have been able to enroll, but if they're part of a mixed status family, their children are. So it was good for us to gather that information. And then we do have identified Spanish-speaking brokers and navigators, and on anything that is tailored for this audience in our advertising, we do always make sure to put that as our call to action, because we find it to be stronger than just the website in general.
Thank you very much.
Okay, so then there are, as Ryan mentioned, there's kind of two overarching larger narratives that are happening, and we have prepared some materials for the exchange to help them in communicating this. The first is the Arpa Subsidies. We have put together some materials and tools for both Ryan and Janelle as they traveled this spring, both in making sure that we're identifying how these subsidies currently positively impact Nevadans. And that's kind of the general direction and approach. And then also just making sure that there's an awareness if these subsidies go away, how that will impact negatively Nevadans. Utilizing storytelling components where you see these pre and post monthly ARPA monthly premiums. I think this is a really nice story to tell. So we've put the exchange put together some scenarios that we have utilized. And then we use some nice visual aids, and some samples of that are on the right here of, why have Nevadans lost their coverage? Why can't some Nevadans find healthcare coverage? Just helping build out who the Nevada audience is, and then making sure that the ARPA subsidies and the impacts of that are very clear for them to communicate. The second is the public health emergency. So we have worked, as Ryan mentioned, in conjunction with the exchange and the state Medicaid office to help put together some materials to support the Medicaid office in their outreach here now. This is a phased approach that we're taking along with the Medicaid office. The first phase started in March, and I'll explain a little bit further, but the first phase is essentially awareness. What is the public health emergency? That it is likely to end very soon, and to go update your information on the Medicaid portal so that they can reach you. And then the second phase is then there will be a drop off of a portion of current Medicaid recipients, and they are best qualified to enroll through Nevada HealthLink, and we're here for you. Let's prevent a gap in coverage. I placed a few bullets here. We in that first survey did a deeper dive on Nevadans on Medicaid. We wanted to better understand that audience if we're going to talk to them, to make sure that we were crafting messaging appropriately. Important to note that 75% of the Medicaid office that we surveyed had been on Medicaid for at least 2 years. So they are, longer standing customers of Medicaid. Only 21% were currently unsatisfied with their coverage. So they're quite happy consumers. And then more than 1 in 3 Medicaid recipients did fear losing their coverage. So there is already a fear kind of prior to this unwinding of public health emergency. And then, who's likely to shift, right? So 20% of those surveyed would shop for alternate insurance plans as soon as possible. So that's great news for us. We know that there's an active customer who would look immediately for health insurance plans. And then, how cost prohibitive is this audience? 15% would be mentioned that they would be limited by financial stability and the cost of plans. That makes a lot of sense. They're currently getting $0 plans. So good for us to know, though, because that will help with our messaging. I mentioned a phased approach. So this is just a little bit of a deeper dive into that approach. The first phase is all about education, making sure that enrollees are updating their phone number, their address, their email address when Medicaid is ready to reach out with redetermination letters. We want to make sure that they can actively reach their audience. And some of the tactics that we're utilizing to do that, we're updating the Medicaid specific web pages on Nevada Health Link, driving to those through some owned content, blog posts, social media, etc. We have the public relations team kind of on standby and mostly keeping tabs on the conversation, what's happening in the government affairs segment. And we've also developed what will be online here shortly, an online toolkit for partners, all kinds of partners that we're identifying to help with outreach on this message, this awareness and education message about Medicaid and the public health emergency. Additionally, we have a paid media plan component. We're still kind of working through what that looks like, but really just driving that awareness message home of going, this is happening. Go in and update your information so that you're ready.
Excellent preparation. I can't imagine that you could do any more. It's really excellent.
The second phase, this is when the end of the public health emergency happens, redeterminations will begin and those consumers will be kicked into a special enrollment period for 60 days. That is our opportunity as an agency to reach out to them, let them know that Nevada Health Link exists, that we have the highest, we want to share awareness of low cost and high quality plans of Nevada Health Link. And this customer is, a very high propensity to qualify for subsidies or advanced premium tax credits. So just making sure that they understand kind of like we're the next best thing. So, but doing it in a really nice way and a way in which, let's prevent a gap in coverage. And here we are with all of these great things for you. This will have a few more targeted tactics. We are able to reach the Medicaid ineligible audience through our email newsletters. So we'll have a stronger email newsletter campaign. We have an opportunity to work with the Medicaid office in adding a stuffer into and send out to their mailing list. So after they've received their redetermination letter and or with it, we can also have that information like you have lost coverage. Here's an option for you kind of right away if you'd like to take care of it. And then again, more own content through blogs, social media, public relations will likely have a stronger presence during this time. It's more actionable. And then at that time, because we know some are losing coverage, we can have a more robust and targeted paid media plan actively targeting them. Well, a couple more things. Of course, we are in a special enrollment period. This is not new for this team, but just making sure that the board did see that we have both English and Spanish special enrollment period advertising campaign in market. This is directed to those that have recently experienced a qualifying life event. You can see the creative on the right. It's very bold, punchy, fresh. We're trying to attract attention, making sure that the messaging is very clear here. I have a quick video, see if it plays. So really trying to make sure that it grabs your attention and brings the consumer through. And then the last component that I'll talk about, paired with special enrollment, we also have owned content, and we really wanted to think strategically about off-season content. So what are we developing for blogs and email and social media, and how are we impacting the community between February and September? We wanted to make sure that we were thinking about the consumer and the consumer's needs during this time period. We always conduct keyword research first. So like, what are consumers searching for in that time period? What do they need to know? Making sure that we're preparing content that speaks to that. And then what we did is we did a lot of research on health themed days and months, health information, and making sure that Nevada HealthLink is seen as that authority on healthcare. And then bringing in our community relations team, our public relations team, and identifying, and also Erica Avila's consulting and what they do, and identifying key events in the community, making sure that we're highlighting those. And any key partners. We really wanted to amplify our partnerships in the community. We have a ton of partners that we work with and organizations, and they're all doing really great things. So we wanted to make sure if there was a nice strategic alignment between Nevada HealthLink and a partner, that we are supporting what they're doing in the community, and that we are asking them to help amplify and support what Nevada HealthLink is doing. On the right a little bit, you can see an example of May. So not only do we talk about the special enrollment period, but we identify there was Small Business Week, National Stroke Awareness Month, Women's Health Month, National Nurses Week, and then some like even smaller community events, the Reno River Fest, Henderson Arts Festival, just making sure that we're really talking about what we're doing and making sure that all the hard work that's being done to be present in these communities is also being amplified through the own channels for Nevada HealthLink. And you can see to the right, these are just some samples of social media posts. Of course, everything is in English and Spanish as well, to make sure that we're identifying and speaking to all audiences. And that is what we've been doing.
You guys always do more than I think is humanly possible. It's just amazing. Oh, my question is, are you going to be planning with this next year to have a more robust in-person presence in our state again?
Dr. Jameson, we do have about 30 or 40 staff members in Nevada. Our headquarters.
Oh no, I mean, where when you're, you know how we used to plan a lot of events out on the field, and with COVID, you had to back off.
Yeah, so we're seeing that we're able to be in person more, which is fantastic. We had a plan to be more present, and then the Delta variant kind of changed everything for us last open enrollment period. But we're seeing that these the events so far that are falling during the open enrollment period and prior to some back to school events that are happening are all very much all systems go. So that's fantastic. Additionally, we are budgeting and working through some plans of being present and engaging in some events in the rural communities. So more to come on that, but we're excited to kind of build out that idea and be more present in person in the rurals this year as well.
Do you think that it was affected you in a negative way, not being able to be out there at events as much?
Yeah, I mean, I think that there was an element of that. We were able to be present in the communities in September for back to school last year, and then October and November for Halloween and Dia de los Muertos down in Southern Nevada. Those are pretty large. We have some pretty large events. So that was a really positive opportunity for us. Where we saw most of the impact was in December and January. So we're hoping to have a little bit more presence during those times this year.
Yes, I just remember hearing often about some of your events and the attendance and how you would get a lot of on-site connects. And so if you compare when you used to have quite a few events out in the community compared to what you're planning this year, what % do you think prior to COVID you're going to be doing?
I will have to check back on that one. I think we attended 43 community events last year, so I'll
But I think
see
prior
what-
you had probably had over 100.
Okay, so 40% increase. Maybe we'll see. I'll check back in and see what's on plan. You know, some events didn't come back after COVID and just didn't make it. And there's some new ones that are kind of coming into the mix. And then we've also conducted an audit on the events that we attended. Were they worthwhile? Were they reaching the right amount of audience? Did we make enough kind of like touch points within those? So we'll come back to the exchange with a recommendation there.
I think we'd like to see that. And because we always used to question, like, how effective were the storefronts? You know, and so with regard to that, I think it'd be a nice thing. Just going back for a moment to page 12, I think it was page 12.
Sure, let me pull that back up.
And just the comment about the one study we were talking about, I think it's important that you do put a notation there if it's 10% of undocumented immigrants, or if it's 30% of undocumented immigrants that attend that. And I was wondering, let me see, next page maybe? You're on 7, 8, yeah. Next page. Next. Go ahead. It was the one with the, it was the page where it was about 20% said they would re-enroll or inquire. Do you remember that? Is it the, I don't think it's the, I thought it was around page 13. Go ahead, go back then.
I was gonna say maybe it's 10, actually. I think it's the
there.
Discussion, yeah. This one, right?
No, yeah, not this page.
Was it a part of it?
I actually think it's page, it's
10,
like 18.
maybe.
It's deeper in.
Here?
Yeah, right there.
Yes, you got it.
Okay,
More
sorry.
than 1 in 3 Medicaid recipients fear losing their coverage. 20% would shop for an alternate insurance as soon as possible. And 15% would be limited by financial stability and the cost of plans. I just didn't understand, is that just the only number of people that responded? What about everyone else?
Right. Oh, go ahead, Peter.
Yeah, this is a drill down on different groups. So this is looking specifically on Nevadans on Medicaid. So remember that N equals 800 that had uninsured, Medicaid, and self-insured. That other slide was just looking at the Medicaid ones only. So just looking at that section.
Oh, okay. So it's the 20% of the total.
Well, they were actually a bigger, because so the Medicaid audience is actually considerably larger in Nevada than the uninsured or the self-insured. It's about 22% incidence. So so that's of that 22%, when we of 22% of all the whole market, that they were that's what they were saying on that other slide, which was I can't remember what number it was, but that's just looking at that. It's from that same survey, but we just took, if we just asked the Medicaid people, this is what we found out about them. You know,
So of the,
they're very satisfied with their coverage. So only 21% are unsatisfied. That's pretty good. And,
right.
And that
Of the 100% of Medicaids.
Of the people that are Medicaid. Yeah, these are people currently on Medicaid. Medicaid has a certain churn that they have in every state.
Yeah.
And so people fall out of Medicaid. That's a good audience for us. So we're kind of trying to learn about them in Nevada to understand where they are and what they're looking for.
Okay. So maybe you could explain that 20% would shop for alternate, meaning they would shop with the exchange.
With the exchange or with in some way. So, you know, a lot of them aren't aware of the exchange. You know, there's that number someplace else, but they would shop for an alternative. Like they would want to get insurance right away. So we gave them a bunch of problems. So we said, okay, you lose your Medicaid, what would you do next? And some people would wait and just hope for the best. Some people, we gave them different options they could do. And 1 in 5 said they would want to get alternate insurance as soon as possible. So those are your most eager.
I guess being that I'm an exchange, a pro exchange, I would have made one of these questions. Would you be shopping on the exchange?
And I think I have to go back to the instrument. I don't know if you remember, Aaron, if we
Because
asked
that's what, that's what I would want to know. I would really want to know that. We're doing this research. I would
Right,
want to know how many of them, because we want to capture this, as you just said, in the Medicaid market.
Right,
And
right.
I'd in a question, I'd even put it out there because you said they might not know about it. So it's a way for
Right.
us, and even questioning them, to make sure they know we're an option. Would you do it? And if some say no, then say, oh yeah, that is an option.
Yeah.
That was all.
Right. Yeah. We've found that this audience does not have high awareness of Nevada HealthLink. They're on Medicaid already, so they don't think that they have to look yet. But I think that the paid media for public health emergency and the other outreach efforts that we're doing is going to help with awareness with this audience prior to them losing coverage. So
yeah, I think your advertising is a wonderful plan. Just would have probably included alternate insurance as soon as possible, including the exchange, because I'd want to know how many of them already know about us who would be willing to come to us. Just keep plugging ourselves. Was there any other questions? Otherwise, you guys are doing an amazing job, and we could go on.
I don't have any questions. This is Katie Charleston. I just wanted to add, I have been on a few of the focus groups, and at the end, they usually give out all of our information. We are Nevada HealthLink. That's why we're asking. Please visit the website, give us a call. So usually at the end, after we get through everything, there is a plug to let them know about us.
Well, that's wonderful at the end, but while questioning, if they give us feedback that they're aware of us, that's really nice too. Before we give them our spiel, gives you feedback on how many people, while you're in the group, would be able to say they are. But moving on then, so we now have, I guess you guys are you finally done, or?
Yes.
And no other questions? Okay, so we'll go on for the approval of the semi-annual fiscal and operational report pursuant to NRS 6951.370 1B to the governor and legislature. Do I hear a motion from one of our board members?
Valerie Clark, so moved.
Thank you, Valerie. And a second?
This is Quincy.
Second from Quincy. And everybody in favor, please say aye. Oh, discussion. Was there any discussion on the report? Okay, everybody in favor, please say aye.
Aye.
Aye. Was there anyone opposed? Hearing no opposition, the fiscal and operational report, the NRS 6951.3701B to the governor and legislature is approved unanimously. So going on, discussions impossible for future action regarding dates, times, or agenda items, future meetings. When is our next meeting scheduled?
Sure, Dr. Jameson, this is Ryan High for the record. October 13th at 12:30 p.m. Unless determined there should be a meeting beforehand, but right now the next one is scheduled for October 13th at 12:30 p.m.
Is there any other, does anybody have anything they want to have brought up at our October 13th, apart from the couple of things that we've already mentioned during this meeting? So I'm looking forward to that. Does someone want to remind us of the two topics we talked about bringing back?
Was it regarding updates regarding ARPA subsidies and unwinding of the PHE?
well, the last one was just regarding the events. And the first one, that's the one I'm having trouble remembering. With our collective team here, all of us might be able to recall the other item that you guys were going to get back on. Hopefully not having to review the whole recording. Perhaps it was just something as simple as something on one of the reports, Ryan, that we were going to get follow up on.
Missing about follow-up regarding the findings and adjustments on the audit.
Oh, that was it. Excellent. So,
and I already,
yeah.
Our staff is so fantastic. I already have those answers for you. So regarding the first one, it was in favor of the consumer. The error was in favor of the consumer. And the second one, it was negligible. It wasn't for or against the consumer. And I can tell you that the two issues had been fixed. They were fixed last September of 2021. So it's been fixed in favor of the consumer and then negligible.
Excellent. So we only have the one item following up on our events for the next year, our calendar of events, and how did that compare to the pre-COVID, and just in general, after you had reviewed everything, what you find to be the most effective ways with regard to events. Certainly your social media has been amazing. And so if there's no other agenda items, we'll move to public comment again.
I'll go ahead and open up all the phone lines. So if you have a comment, you can go ahead and have it up.
Is there any public comment on our phones? I see a lot of phones on the board, but I don't see anybody raising their hand or anybody saying anything. Okay. So then I think,
Madam Chair.
Yes.
Sorry, Madam
Yes.
Chair. I just wanted to say that there is, for the record, there is no public comment here in the conference room as well.
Oh, thank you so much. Okay, so that being the case, I would say we'll take a motion for adjournment. Oh, first I want to thank everybody. The board, thank you for your participation and your input. And of course, thank you to our wonderful exchange team who is doing an amazing job. And as somebody during the course of our meeting said, they're only looking forward to trying to keep reaching further and further to those that we haven't been able to connect with and get more and more enrolled. And it'll be exciting to see how other things unfold with the emergency Medicaid ending and how many we can capture, and also what the public option might bring. So we'll see what the future holds for us, and hopefully just we'll be able to help more people who have not had access to healthcare and improve their quality of life and let them sleep at night because they have healthcare for them and their families. Thank you guys. You're doing an amazing job. And adjournment, does anybody want to move to adjourn?
Sarah Friedman, I will move to adjourn.
Second, Valerie Clark.
All right. And unanimous, everybody, see you in October.
Thank you.
Thank you so much.
Wow, everybody.
Thank you.
Thank you.
Bye.